Hello. Welcome to the Massachusetts General Hospital Frontal Temporal Disorders Unit Community Forum Friday. Today's session is Staying Healthy Together, Updated Guidelines for Staying Safe from COVID-19. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the MGH FTD unit, and I'm so happy to be with all of you today. This is an incredibly important session as we're, 7 months into pandemic life. And I think that as people are starting to adjust to the changes that we've all had to deal with, they're continue to have questions about what happens when I want to resume some of the activities that I used to do before pandemic was present. And one of those very important activities is knowing how to go back to the hospital, how to go back to MGH for your clinical care and to participate in research. So today I am so proud to welcome my colleague in research, Judit, a member of our MGH COVID Safety Officer team, to help us understand what are some of the things that MGH has done to make it safe for us to come back to the hospital. Hi, Judit, welcome.
Hello, everybody. Thank you so much. Thank you for having me here. It is an honor. I'm very excited about this opportunity and being able to tell you more about how the hospital is making sure that they are not only keeping their employees safe, but they are emphasizing keeping patients coming in, whether they are clinical patients or research participants. So thank you so much for the opportunity.
It's really incredible, Judith, to think about all the work that's been done at the hospital to understand the COVID-19 virus, and then to have that resilience to say, you know what, this is a new challenge, but we are going to develop new protocols and procedures so that we can keep going because families still need care. And I know that especially in our community, people are so committed to research because we want to have that hope that the treatment and cures of tomorrow are not so far from the care of today. So,
Sure.
Judith, I would love it if you would start by telling us a little bit about yourself.
Again, my name is Judit, and I am a microbiologist, epidemiologist by trade. I used to work for the Ministry of Health in Hungary, then moved to the United States. I've been with MGH for 7 years now in different capacities, mainly management positions. I used to work for the Martino Center for Biomedical Imaging at the Charleston Navy Yard. I managed the positron emission tomography lab for production and quality control, and then transitioned into the research field more of a interfacing with patients rather than being um, involved with production, manufacturing, and quality assurance. I became part of the All of Us research program. And right now, I am the Senior Research Project Manager at MGH and at North Shore Medical Center. Just a little bit about the consortium. The New England Consortium includes some of the partners sites, including Brigham, Faulkner, Newton, Wellesley, MGH main campus, of course, North Shore Medical Center, and some of the um, community health centers in Chelsea, Revere, Brookside, and Southern Jamaica. When COVID hit uh, Massachusetts, uh, the very first steps that research groups took is that they basically withdrew from the day-to-day activities and they allowed clinical staff to figure out how they will be managing incoming clinical patients and making sure that patient care will take number one priority. Since then, we all learned a lot about treatments and how we're going to work with the different logistics, different protocols, adhering to guidelines, which were in the beginning, they were changing almost on a daily basis and they were developing rapidly. And now, as of June, the clinical leadership felt very comfortable allowing research activities to resume in clinical settings. And I have to say that the clinical leadership welcomed research back into the environment. Of course, we had to make also sure that we are following all the guidelines and we are not impacting the already burdened clinical workflow. So that is one of the things I would like to tell you about, which is there's a lot of overlap between clinical care and research because right now, because a lot of the patients who would come into for any kind of treatment or intervention, sometimes they pair their clinical appointments with some of the research appointments. So there is a tremendous overlap, and it can be overwhelming what to do and how to go by it. And hopefully, by me telling you a little bit about it, will make it a little bit more transparent and easier to understand how certain things have changed.
Exactly. And that's our goal for today is to just help people understand what will your experience be like and for everyone to hear how thoughtful the leadership at MGH has been about figuring out how people can safely return. And so I know you have some slides to share with us, but I was just thinking, Judith, as you were introducing yourself, what a perfect person you are to talk about this with our community because so many of our research participants have been in our Charlestown office and had scans in the Martino Center. So you really know what it's like to have that experience that our families are engaged in.
Yes, I do. And hopefully, what I have to tell everyone is going to be a very useful information.
So I know that the studio will advance the slides as you direct, Judith, and if it's okay with you, if a question pops up, I will address it while you present.
Oh, wonderful. Yes, of course. So we can go to the next slide. This is just a little bit of introduction, and I did tell you a little bit about myself, but I felt compelled to put this picture on the very top because what I'm going to be talking about today is all those people who you see up there, they all are very committed to keep patients safe and making sure that the pandemic is under control and our hospitals can handle the incoming um, patients who need clinical care, not just COVID-related clinical care. Next slide, please. So we have heard this one over and over again, but it still stands and it's truer than ever before. We are all in this together, and every aspect of our life is being affected, whether it's uh, family, just being able to spend time together, especially extended families, being able to do everyday chores like shopping, and including going to the doctors. Next slide, please. When I look at the guidelines, the very basic guidelines of how to keep each other safe, to me as an epidemiologist, it is one of the most simple steps that they outlined for us, researchers outlined for us, including, and I'm going to mention Dr. Fauci, outlined for us how to keep ourselves and each other safe. Very simple, wearing a mask, then cleaning your hands on a regular basis, maybe a little bit more with more frequency than what you used to do. If you don't have resources to wash your hands, hand sanitizers work really well as well. The third one is probably the most complicated one and the most um, tasking step, because we need to keep the distance. And sometimes it's very, very difficult to keep the distance. It's so hard. Not, it was in the beginning, at least for me, it was so hard not to reach out for someone's hand and shake hands. And then just even with families, right? Family members, extended family members, giving hugs, etc. That had to be taken into very careful consideration. Whatever came naturally and instinctually to us, we had to think about it twice. Now, when you're a caretaker, this is probably the most complicated thing to keep track with, yet it is very uh, easily um, it can be very easily complied with as long as people are thoughtful about what they engage in terms of close contact or not. That used to be, those three areas used to be the top three priorities for everybody to keep patients and staff safe. Now, our leadership and our infection control center added getting a flu shot. It's not just important for clinical staff and employees to get the flu shot, but also everyone out there who are going to be seeking clinical care during the flu season and even beyond. It is just something that they, at this point, they are highly recommend to everyone to obtain to get the flu shot.
Judith,
Next slide.
I love the way this is presented as the core four to stay healthy. That's a great way to remember it. And what you just spoke about for our caretakers who have loved ones who may have a difficult time understanding these things, I just wanted to give an extra plug for our weekly support groups. That every week we're running online support groups where you can come and talk to other caregivers who might have tips about how they're helping their loved ones who might have difficulty understanding these new rules, how they're wearing a mask, how they're making sure to wash their hands and their loved ones' hands extra, and then how are they coping with physical distance when sometimes the way that we communicate with our loved ones, where language is a challenge, physical distance is even more critical. So I just wanted to thank you for acknowledging that and to remind our community that there are supports to help you and your loved one follow this core four.
Core four, the very simple core four, and it's imperative that if we keep this on mind, we can really turn this pandemic around. Next slide, please. The MGH is very, very committed to, like I mentioned, to patient health and safety, and they are also extremely committed to keep the employees safe. Therefore, they can show up every single day and take care of patients. What happened right after the pandemic hit, in a clinical environment, all clinicians were urged to wash their hands even with higher frequency. So in the beginning, they were just basically verbal instructions, and everybody was trying to see what to do, right? Because we did not know a lot about the disease, but we did know that washing our hands would make a huge difference. So we have increased the frequency and intensity of cleaning of all high touch areas. Housekeeping has been trained and introduced new steps to make sure that high traffic areas where patients are present are being cleaned in a certain manner that they maybe in the past they did not pay that much attention to, or they might have used different kind of cleaning solutions.
Mhm.
And we require frequent hand cleaning, and we also added hand sanitizer stations so that both the patients and staff can sanitize their hands as they walk by. If you have not been back at MGH or any of the facilities of Mass General Brigham since the pandemic hit, you would be just surprised about the number of hand sanitizing stations that were installed. You cannot take 6 steps without bumping into at least one hand sanitizer dispenser. Also, what MGB also implemented was they installed mask dispensers, automated mask dispensers, besides just staff handing out masks. So that was a big step. And we also follow very special infection prevention guidelines. They are mainly guided by the CDC, and our infection control command center adopts those guidelines and implements it within the institution. Next slide, please. And we protect our environment and everyone in our environment. We require all people, employees, patients, and visitors at the facilities to wear masks. The reason why we do this, it's called the universal masking policy. Because in the beginning, when the pandemic hit, only clinical staff was required to wear masks, and patients could come in without wearing masks or even being taken care of while not wearing a mask. We did not know so much about the disease, and we certainly did not have a lot of data on asymptomatic patients. What happened was some of the clinical staff did get sick, and during tracing, we found out that it was leading back to one of the patients whom they took care of. So the universal masking policy was rolled out very, very quickly to make sure that now the staff is also protected, which made a huge difference. We had an incredible drop in clinical staff infection rates right after the universal masking policy was implemented. So when you come into the hospital, and you will see one of the employees maybe just reminding you gently that, can you please put your mask on, or I can give you a mask, or can I help you to adjust your mask, or can I please show you how to put your mask on properly? That's one of the main reasons why we're doing this. We are asking the patients to wear these masks because we need to protect our employees, and we need to protect our patients as well. We also rearrange spaces to accommodate physical distancing and prevent transmission of infections. And we removed chairs from the waiting rooms and the high traffic areas. And we also installed plexiglass barriers, not in every areas, because the air that you're breathing in is could contain the virus. So the best protection is not plexiglass barriers, but the masks. Washing your hands, going back to the top 4, keeping the distance, and get your flu shot. When you go into the patient rooms, waiting rooms, you will find that some of the chairs would be taped off, or you would just find that if the furniture allows space to be created, we would remove furnitures from certain waiting rooms. So you will see just a couple of chairs there, possibly. Even the chairs are put very far from each other, definitely making sure they are at least 6 feet distance apart. Sometimes people move those chairs around. Sometimes they try to take the tapes off, and you might find that clinical staff might just walk over to you and they will ask you about the relationship. Is it just are you accompanying someone? Are you a caretaker? Are you a chaperone? Or you just haven't seen each other forever and you happen to bump into each other in the meeting room. So they might ask you to evaluate that situation.
I
But
think,
I do want to make, oh, I'm sorry, go ahead.
well, that's so important what you're saying, Judith, because, one of the things early on was that there were no visitors allowed. And so on your slide here, it says we limit visitors, but it's very important for the families in our community to hear that if your loved one has dementia, that the policy at MGH is that they are allowed to have a care partner with them for their appointment or procedure. So we want everyone to know that you do not have to drop your loved one off at the door, but that we're working on making accommodations for you to stay together.
That is correct. And we ask the caretakers and caregivers to get prior clinical approval for for the appointment when they are going to accompany the patients for. Therefore, it is a very, very simple step for them. And then later on, I'll touch base about this very topic. But we do limit visitors, and you're correct, Katie. There is a huge difference. What used to be no visitors at all at the very beginning, and now we're limiting visitors. And the visitors are limited based upon uh, the level of care that needed to be provided. So that clinical staff will, or the research staff will evaluate that. It also being evaluated by a screening process, which I will talk about a little bit. And basically, if anyone has any symptoms as a visitor slash caretaker, they will not be allowed on the premises. So that is one of the things we're going to be talking about. And we have to have a backup plan. What happens if I have a symptom and I'm supposed to take my uncle to an appointment? What do we do? We'll talk about that a little bit, and questions are also welcome. So we wear the mask and definitely follow social distancing guidelines when providing care and in home for patients as well, because uh, some of the services we provide is in home care. Next slide, please. So here we go about screening. Very early on, leadership has implemented, an Infection Control Command Center implemented screening procedures. We call it the COVID Pass for employees. It was very early on implemented, and it's basically symptom tracking, and anyone with symptoms of possible respiratory illnesses are absolutely not allowed to work, not even if it's just a very slight symptom. Infection control also encourages employees that even if the employee thinks that it might be just their symptoms might be just related to, let's say, allergies, they should still not come to work. And we go through very rigorous and effective COVID test screening as employees, and we are not allowed back into the facilities until occupational health clears us to come back. So the institution monitors employees very, very closely. We also screen the visitors, which we talked about a little bit, and they are basically based on symptoms. And there is a couple of snapshots that I took from the computer screen, what it looks like when you would be completing this COVID pass for visitors at home. But also, if you happen to not remember this to complete at home, there are QR codes placed at every entrances um, in the hospital and throughout the institutions that you can scan with your smartphone, or you can just log into that URL link and complete the form. So This form right now is in two languages, English and Spanish. And then you would have to pick, am I a patient or am I a visitor? So when you're a caregiver and you are accompanying the patient, you would choose the option, I'm a visitor.
And
And
Judith, if you do not have a smartphone and you arrive at the hospital, would there be someone there to help you fill out a COVID screening?
yes, there will be someone to help to fill out the COVID screening. It usually happens at the reception desk of the clinic where you go to. So there are so many different ways that the institutions are reaching out to both visitors and patients to make sure that they do get screened. The recommended procedure is to get the patient screened at the time of the scheduling, and then reminders, screening links, whether it's a text or email, or if they log into their gateway portal, they try to reach everyone with so many different means,
Mhm.
by using so many different means to make sure that they do get the opportunity to complete the pre-screening prior to coming into the facility. And I'll tell you why later on when we go down into the slide later on, there is a slide about it, why it is important to complete this pre-screening prior to coming into the hospital, because should there be any instance when you might not be getting the green COVID pass as a visitor, as a caregiver, uh, that could create some unforeseen possible frustrations on your end, because now there are great limitations, and clinical staff will always additionally evaluate the situation and could make exceptions with permission of the leadership, the clinical leadership. So at that point, when you're when you're choosing the option of I'm a visitor, you would have to choose, am I a supporting patient for an appointment? And that's what you would be if you're chaperoning somebody. Or am I just visiting an inpatient? Next slide. Unfortunately, you might not see very clearly. The letters are pretty tiny, and I have hard time seeing as well, but I am very familiar with the form, so I can just guide you through it very, very quickly. So when you pull up this form on by using the link, or even just scanning the barcode, it will be asking you for your first name, your last name, and then you would enter your email address. It's always a prudent thing to do, because then you could actually just show your email whether you were cleared for the particular appointment or not. And so you can show it to the screening person who might be stopping you when you come into the hospital. And then if you are here for a research study, you would just check this little checkbox that says, I am here for research. I'm sorry if you cannot see it, but it's there. Now, it will be asking you if in the last 14 days, have you been diagnosed with COVID-19? So you would have to click yes or no. The next question, in the last 14 days, have you been in close contact with someone who was diagnosed with COVID-19? You would also choose yes and no. The third question is very, very important for anyone who is a visitor, because you do have to be cleared, and this is what we talked about earlier. You have to be cleared by the clinician to be able to come in and accompany the person who has a clinical appointment or a research appointment. So you would have to click yes if you do not, if you're approved. If you are not approved, I would contact either the research staff, the research coordinator, or the clinical staff to make sure that they have your name on file. And now you can say, yes, I'm cleared with clinical leadership, clinical staff to accompany the patient. Then you would click continue. Next slide, please. The next section of the screening form will include something just like this, fever or feeling feverish. Now, very important, they will ask you about new cough and new nasal congestion. So this has to be something new. That's not a chronic symptom in your everyday life. They are going to be asking you about muscle aches, shortness of breath, new loss of smell, as we learned as throughout the entire dealing with the pandemic. We learned that a lot of patients do lose their smell or taste, or sore throat. And there is an option for no symptoms. Next slide, please. Now you can see two COVID passes here for visitors. One is a green pass. The green pass for Cinderella denisis is in a case when Cinderella did not have any sections in the questionnaire that she would answer with yes, except that, yes, I am accompanying someone, I am a caregiver, and she did not answer yes to any of the symptoms. Basically, there were no symptoms. The next option would be for Captain Hook. Captain Hook was either exposed to COVID-19 at one point within the last 14 days or had some slight symptoms.
Right.
In this case, the support person would get not cleared for the visit. And this is what I'm going to just return to one of my statements earlier. This is why it is very, very important to try to complete this COVID pass for the caregiver prior to leaving and coming into the hospital, because this could determine whether you would have to make additional arrangements to make sure that the patient is accompanied in a proper manner to his or her clinical or research visit. Are there any questions about this, or should we just wait, Katie, until I'm done?
We don't have any questions right now, but I just
Okay.
love the way that you're going through it step by step, because I think that the more people know ahead of time, the better they can be prepared. And really, even just seeing these two passes, I think it just lets you know what will happen if I'm not able to answer the questions and get cleared. And,
Yes.
you know, if you end up like Captain Hook, then you can get support from maybe your primary care physician or your healthcare provider, but it really just lets you know you're probably going to have to reschedule that appointment that you were trying to go to.
Correct. If you cannot make any additional arrangements for being able to make sure that the patient can make it to the appointment, it might have to be rescheduled. So it would just save you a lot of time, if that's the case, right? To call the clinic back and let them know what your COVID pass is like for today and can we reschedule or not. And they will be able to reschedule you for another time. Very often what happens is that rescheduling happens 2 weeks out. So they are giving everybody 2 weeks of grace period to actually get over those symptoms that they might have had, or just be removed 2 weeks out from the time of exposure to a COVID positive patient. Next slide, please. We also test and screen the patients for COVID-19, of course. The criteria will be a little bit different for giving COVID passes. And the reason is that very often when someone might have symptoms, they are not going to get turned away by clinical staff, and they will be evaluated for the severity of the case, and and also for the type of clinical care or intervention that they are seeking for that very day. It's wonderful to be able to say that our clinical staff right now is completely prepared to manage clinical care or research studies for patients coming in who might have some symptoms, because we have segregated areas for them, designated areas where we use personal protective equipment, right? And we follow all the Centers for Disease Control guidelines for all these possible COVID-19 cases as well, but we do not turn them away, like I said, if their clinical care is absolutely essential for that very time being. So admitted patients to our hospital are tested for COVID-19. And I have to tell you, my research staff is involved with a lot of inpatient approaches, and they talk to inpatients, or my research assistants talk to inpatients all the time. And it is extremely impressive how frequently the inpatients are getting tested for COVID-19 for two main reasons. Again, to protect the other patients who are on the floor, and also to protect the clinical staff who takes care of them. We also have walk-in locations, and we adhere to the best practice safety protocols in those settings. And those are the ones that I talked about earlier, that all of those safety protocol steps are basically guided by Center for Disease Control, because walk-in locations, we do not have the luxury of rescheduling, because or just even scheduling, right? Because it's when very often when somebody goes to a walk-in location, the case is severe and it needs to be addressed immediately.
Mhm.
Also, when providing care in the home, we screen the patients prior to sending clinical staff to take care of the patients. So clinical staff make sure that when they find themselves in a situation, they are very much aware of what the situation might be in the home that they are going to be providing care in. Next slide, please. So these are the multi-level approaches where the clinical care is making sure that we are screening everybody, and we are making sure that we are protecting other patients, and we're protecting our clinical staff. Very often, when you have an appointment scheduled, you might get a text. It depends on what your primary contact preference would be. You might get a text from as a reminder for your appointment. Very often, the text would include the link. When you click on the link, that will guide you to the screening form. Also, if you signed up with Gateway, I would highly recommend this to everybody, because it is just such a convenient way to renew prescriptions. It's a very convenient way to schedule, reschedule, communicate with your provider. I have to tell you that now, more than ever before, uh, the clinical staff is so burdened with patient care and making sure that those additional steps in making sure that everybody is kept safe, affecting their clinical workflow. And it is, they always get to their messages, they always get to making appointments, but at least it saves time for you, because you might not have to wait in a queue and 5 more minutes, or all of our operators are busy. Gateway is a fantastic tool to use. Also, if you chose email as your primary contact source, you might get an email for the clinical appointment, which will also include the URL where you can log in and complete the screening form. Very often, especially in research, you might get a phone call reminding of your clinical research appointment, and you might talk to a a research coordinator directly who will remind you of your appointment if there is no signs of being, and they will remind you to complete your screening form. Excuse me about that. The in-person um, reminder for screening is that when you walk into the hospital, and that's probably the last minute thing, but life happens. Sometimes people forget, right? So there is an extra level of security introduced in admitting patients into the clinical facilities by screening them. Sometimes it happens at the security desk. Sometimes it happens at the reception desk of the clinic. When you walk into the hospitals, you will find that security will stop you and they will ask you where you're going, who you're seeing. If you are with someone, they will likely ask, have you been approved to accompany this patient for their appointments? So all those things that are really, really good to prepare for so that you can say yes to all of those questions except exposure and symptoms.
Right.
And they will let you into the facility. Also, I thought Kitty, were you going to say something?
Oh, no, just saying that it is true that they are really paying attention at all the entrances. But I want to assure everyone that whether it is a security officer, a nurse, or even a member of the cleaning crew, people want to help. They want to help you achieve getting where you need to go for your appointment in a healthy, safe manner. And so it's fine to say that you need help, that you're not sure who you're supposed to talk to or who you show your COVID pass to. The team is there and they're expecting that you're not going to have the protocol memorized.
Absolutely. And just on a side note, like I said, I have worked for different hospitals and different healthcare within the healthcare industry, and the level of thoughtfulness
Yeah.
and caring, the way the MGB community and clinical staff got together to make sure that they can do their jobs and they can take care of patients, they can continue saving lives. It was unprecedented. I've never seen anything like this
Yeah.
before. And the friendships and level of professional relationships that got formed throughout this time. If there is a silver lining, I would say this is absolutely the silver lining. And a commitment to patient care is absolutely stellar, in my opinion. So when you come in, yes, just like Katie said, please do ask for help because everybody is there to help you. And and even if you forget something, even if you forget to ask because it might not be trivial to you, you'll be reminded. Very often, just like I said, you will be asked, can you please put your mask on? So let's talk about the masks a little bit if we still have a little bit of time.
Yeah, we have a few more minutes, Judith. So it's funny how time passes so easily in these webinars.
Yes. So let me talk to you about mask a little bit because since my research group returned to face-to-face activities and to the clinical setting, I got a lot of feedback on that the patients who come in or research subjects who come in, they would like to wear their own mask. So it's very important to know that the mask that you might be wearing, it might be very effective, might be very good, might be but has not been approved clinically to make sure that it is doing its job. I have those cloth masks at home as well, but when I go into the hospital setting, I always wear the surgical masks that were issued by the hospital. So that's what the hospital is asking, to make sure that patients and incoming research subjects switch their own masks to the hospital issued masks. So it's very important. Also, we're not recommending double masking. As long as somebody is wearing the surgical masks the proper way, pinched around the nose, making sure the nose is also covered, because as you're breathing, you're not just breathing the virus in and out through your mouth, but also your nose. So it's very, very important to cover your nose and cover your mouth and try to make sure that it's also tightly fitting on both sides of your face. So that's about the masks. I wanted to just make a comment about it because recently we found out that there had to be additional steps to explain why we want the patients to change their masks.
All of these little things add up to helping people feel more comfortable and confident that they
Yes,
can come back in. So it's very important, Judith.
yes, it's very, very important and they work. Next slide, please. When a patient comes in and let's say they report some symptoms or exposure, they will get the yellow pass, which is Mickey Mouse. And Daisy Duck had no symptoms, no exposure as a patient. So for patients and a research subject, there is no red COVID pass. So you will not see this. But if you do get a yellow COVID pass, you can see it on the bottom. It will say additional screening required. I would highly recommend you to call the research group back who you're seeing, or call the clinical um, uh, reception desk for the clinic back and let them know that you got yellow pass,
Mhm.
and then they will just screen you further. Now, again, they were very likely to admit you into the hospital, but it will depend on the type of appointment you have and the type of intervention that you're seeking for that very day. Next slide, please. And it is so true more than ever that we are at our finest when we take care of each other. And MGB has been proven this statement to be just right.
Judith, thank you so much. That was such a comprehensive and I think gentle presentation about a topic that is making people have so many questions. But it is such a reflection of the work that MGB and people like you who are doing additional work in addition to your regular position to become a COVID safety officer. And I wanted to thank you for your time and dedication so that our community of families can come back in. And we have other thank yous from folks who are watching as well, and
It's been an honor.
so much.
Thank you.
And so for everyone to know that this session will be posted on our MGH FTD unit YouTube channel. And we hope that it will become a resource when we're scheduling people to come back for the first time, that we can point them here to help walk through the steps and help them feel safe and comfortable. Judith, I hope that you will stay safe and be well. And thank you for your dedication and your compassion for our community.
Thank you so much. Thank you, everybody. Take care. Stay safe.